Hello and welcome to another video on the application of functional medicine with the Truly Heal app. My name is Benedict Frightened and I'm a nutritional medicine practitioner. Today we're going to be talking about the practical application with the Truly Heal app for a specific cause of disease for our patient that we've been working with all along. And today we're going to be talking about toxicity in particular. So as we went through, so I'm just going to go into the patient here. As we went through the patient, through his questionnaire, through the timeline, and then through the different body systems, we noticed that toxicity is quite a predominant issue in this patient. So I'm just quickly going to summarize the notes that we found inside the questionnaire about toxicity and what triggers me to then look at that individually. So quickly, we're just going to go into oral health. And in oral health, we noticed that he has 6 amalgam fillings. None of them removed, but that is still a point that we definitely need to investigate. Amalgam fillings increase your risk of mercury toxicity by a lot, so it's something that we should investigate further just to make sure there is no mercury inside his tissues and it's all stayed inside his teeth. So I'm just going to cancel that. The other thing we straight away found with the toxic assessment here in the questionnaire is that he also eats canned tuna 4 times a week. So again, that's another point of concern for mercury because tuna contains the highest level of mercury out of most fish really out there. So that's again a point why it's reinforcing that we need to look at mercury toxicity. Then here, he is by profession, he is a carpenter, and he said he works with a lot of glues, paints, and varnishes. So we really need to make sure that those are being detoxified properly, that he's using the proper precautionary methods. So again, a reason to look into the toxicity chapter. And then lastly, deodorant. And surprisingly, it was quite a predominant point I noticed when the patient came in. He smelled very strongly of deodorant, and when I found out which type it was one that contained aluminium. So it's something I wanted to investigate further. And then the last point for toxicity was that he smoked in his childhood. And his mother also smoked just before she became pregnant. So that's something we wanted to look at. So I'm just going to go cancel and I'm going to go into the toxicity chapter, where we can look at all these things more specifically. So inside the toxicity chapter, again, we have a number of different categories, and I actually prefer to do them more or less chronologically. So types of toxicity, and here we're more or less filling out things that we already know, except while we fill this out, I can really talk to this patient and start advising different things. So in the dental section, we know that he has amalgam fillings. So what we did here is I talked to him about amalgam fillings, about the risks these can have, and what possible things he could do to get them removed safely with a holistic dentist so that he doesn't increase his toxic load for mercury. And we discussed that, and look, it's not something he wishes to do at the present, but it's something we can look into in the future. So again, I've touched upon the point, I've made a note, and that's perfect. So now I'll collapse that. And then heavy metal. So heavy metal was the points that we saw before. So the cadmium and the aluminium, most specifically. So cadmium from his mother smoking and when he was smoking, and then aluminium from deodorant. So I've advised him, first of all, just to swap to a different deodorant. And I gave him a number of different options of which aluminium-free deodorants he could use. So I tagged treatment just because I have advised something there. But it is still alarmed because we wanted to make sure that the cadmium there and the deodorant needs to be tested, which we haven't done at this stage yet. So I'm just going to go cancel there. And now we'll go down to chemical toxins. So chemical toxins, again, he works with varnishes, paints, and glues, and he has quite a high exposure. So I just chatted to him about how we can minimize that exposure. Does he wear gloves, masks? What kind of air circulation is in the room? Is there any alternatives to non-toxic solutions? So we really just had a chat about that, just quite a natural chat. And we found that there is actually quite a lot he could do to minimize his exposure. So again, basically all it did is prompted me to think about it and prompted me to ask him questions and come to more or less a solution. So again, really helpful. Just to expand that, chemical toxins, we've got the different types of chemical toxins there can be. So lastly, environmental toxins. I didn't touch upon this because, look, I really discerned with some patients, and for this patient, it was really important that we do the gross basic things. First of all, we remove those really core toxins. And I didn't go into, water purification and making sure he isn't drinking from plastic bottles, because there's so much more vital things I can do with this patient at this point in time. It's something I will look into in the future, but right now I didn't want to overwhelm the patient, and didn't want to scare him too much that there's too much to do. So again, really important this section, but I left it alone for right now. And then dietary toxins, as we know, with this amalgam fillings. So here we can see the amalgam fillings. Dietary toxins. I'm reading the wrong things. Dietary toxins. He has tuna, so 4 times a week, and I've advised him to replace that tuna with wild salmon. Very basic solution, but salmon is a great fish. It contains high omega-3s. The wild salmon contains a low level of mercury and other heavy metals, so it's a great solution, and it doesn't actually stop him eating fish. So we've done that, and he seems quite happy to replace tuna. It just was not something he was aware of, so quite an easy fix, and just prompted me to do that. So this chapter also talks about organic, non-organic pesticides, herbicides, which I haven't touched upon necessarily with this patient yet, but it's something we can go in the future too. So I'm just going to press cancel here. And that concludes this section here. So what I'm going to do is I'm going to collapse it just so you can see. And then I'm going to go back to toxicity. So I've made a note on the overview here, just for my personal reference, of the things that I've advised. So I'm a guide against tuna consumption, and advise a different deodorant use. So that's just the basic things we've done in there. And that's more just for my reference. And I know I've got a flag there that that section inside there is in treatment. Now, tests for toxicity. So we are assuming that this patient has toxicity. So, to be a good practitioner, we need to make sure we are testing them. We are doing functional testing. So I have chosen hair tissue mineral analysis. There's a number of different ways that we can test heavy metals. Some better, some worse. Most of them are listed here, and you can read about them, the limitations, the benefits of them. So it's really useful knowing which ones do what and why I would use this one for this. So it just prompts you to understand that a little bit better. So I've chosen hair tissue mineral analysis, and if I open it up here, we can see that I actually ordered a hair mineral analysis test. And I have actually got the results already, so we'll open them up just to quickly show them. And I found that the patient did have exactly what we suspected. So he had a higher mercury, cadmium, and aluminium load, as well as arsenic and beryllium a little bit. But really, those ones are surprisingly higher than all the rest, exactly as we suspected from the client intake, the questionnaire. So with this functional testing, it's confirmed what we've suspected, which is really important, because when we treat, we want to make sure that we treat with a surety. So what I'm doing, I'm just going to close that down and go back to here. So again, I've basically indicated that there's a pathology here, which means that with that flag, I can see that there's pathology attached there. In DNA detoxification nutritional testing, I've also ordered some tests there. Unfortunately, I haven't got the results there to show you yet. I've just shown you, written here that I have ordered them, but I have already tagged pathologists, so I know that I'm waiting on something to put inside this category. And for these tests, I am suspecting that there may be some CYP problems for this patient. Probably not as dramatically, but more importantly, I'm suspecting that there's definitely a glutathione problem, possibly a superoxide dismutase, and COMT, which has got to do as well with his stress management, and his adrenaline and dopamine clearance, catecholamines. So something that's going to be really interesting when we get these results back, just to see how we can tailor the treatment more specifically for the patient to make sure it's fitting with his genetic profile and his ability to detoxify, not just how the body should detoxify if everything was optimally working. So we'll cancel that. So that's tests for toxicity. And again, as I said, I haven't done any of the other ones just because I did those 2 that I found most relevant for the patient. And of course, financially as well, that he was willing to do. So go back to toxicity as an overall, and we'll go into heavy metal detailed analysis. So here, basically, it breaks down all the different heavy metals that we can have. And I know from my hair mineral analysis that the patient has aluminium, cadmium and mercury. So if I open up aluminium, I can see the toxic effects, the sources, the chelation of it, detoxification symptoms, and mineral antagonists. And surprisingly, if you remember back to the hair mineral analysis, these were quite low as antagonists to those higher heavy metals. So they really do show that antagonistic play going back and forth. I personally don't look at the general minerals so specifically in hair mineral analysis, more for the heavy metals in that test. I'd use other testing to assess these minerals inside the body, inside the tissue. So for this, I've assessed what possibly we could do for the patient, and I've advised 30 milligrams of zinc picolinate in the morning, with food. Chlorella supplementation, which we're going to slowly ramp up, and we're going to have that away from food, which more specifically is away from that zinc, because we don't want that chlorella to bind any of that zinc that we're taking. And we're going to work our way up from the 3 grams a day up to 6 grams over the next 2 weeks. And then cilantro. Cilantro is an excellent detoxifier. It really helps the liver clearance and is quite a potential potent binder of heavy metals. So we're going to try and include fresh cilantro in as many meals as possible. And that's going to, for now, complete the treatment for this. So what I'm going to do is cancel here, and I'm just going to show you that I have advised the same thing for cadmium. So I've basically chosen that zinc, cilantro, and chlorella because they are the common denominators among these 3 different heavy metals. So again, I've more or less documented the same thing in each of them just to give myself a note and know that these 3 factors are in treatment. So again, just to show you, I'll show you that in mercury. So mercury, we've got toxic effects, metal antagonists, sources, and that I have just copied more or less the prescription that I have into there as well. So we'll cancel that. But this is a really, really useful page, and I use it a whole lot just to know the specific antagonists for each heavy metal, the toxic effects, the sources, how I can best chelate it. And yeah, really, really helpful chapter. And I use it all the time whenever I'm analyzing any type of heavy metal functional testing. So again, I basically copied the different supplementation and treatments that I've advised just to put them here as an overall, just so that's easily accessible for me. So found that there was cadmium, aluminium, and mercury. I've advised the following things for this patient. So I've got a treatment here. So I'm just going to cancel that. And then lastly, we've got detoxification treatments. And this breaks up into preparation and treatments. So in preparation, we've got kidney support, PEMF, and liver support. So in PEMF, so PEMF is pulse electromagnetic field therapy, and it really helps the body detoxify. It stimulates the cells to function properly. So the patient is doing PEMF anyway, and he has been doing it for a little while. So I've basically just advised that he continues doing this because it is a really potent therapy to enhance the potential of others. So I'm just going to cancel that. And then liver support. So liver is a really important aspect of all detoxification because our liver is our primary detoxifying organ. So here I have put the patient on a multi-B because, look, I want to support liver function. I don't want to necessarily cause a strong detoxification. This patient is quite toxic and I don't want to have that detoxification backlash. Because he is in a fragile state, I want to do this gently with supporters, with cofactors. So a multi-B vitamin is an excellent way to as a cofactor, and it's supporting his liver function, it's supporting his methylation, his DAO enzymes, which is due to his histamine detoxification, and also his energy with those B1, B2. So we're supporting that energy cycle as well, ATP production, which in this patient could very well be compromised due to acidity and a whole range of other things. So I'm just going to cancel that. Close these up, and we'll go back to detoxifying treatments. And in treatments here, there's a whole range of other things that we can do to support that detoxification besides those specific antagonists or chelators for heavy metals. And as we can see, there's quite a list here. Everything from colonics to zeolite to liver flushes. But really, I wanted to do something that was simple for this patient, something that he could do easily, that wasn't going to change too much of his lifestyle. So he is part of a gym. So, and he says he doesn't use his membership, but there is an infrared sauna in the gym. So I've basically just told him to go there once a week and use that infrared sauna. Something simple he can integrate into his life and has a potential to increase his detoxification, help his lymphatic system, and hopefully get some of those toxins out via the skin, especially those chemicals which he's getting through his workplace. So I'm just going to cancel that and then go back to toxicity because that concludes that. So here I've just made quickly my note just to show that I've prescribed infrared sauna and to continue his PMF treatment 2 times a week. So that concludes my video about toxicity. I hope you've seen how the Truly Heal app can really help and prompt me to find the underlying causes and underlying issues with this patient, and how it really creates a thorough and very comprehensive flow through the various factors that could cause issues. So thank you very much, and I look forward to speaking to you next time. Bye.